thank you very much for joining us for this amazing discussion where we are talking about optimizing the supply chain. And we have amazing three stalwarts from the industry. And before we start, let's just dwell upon what supply chain and what kind of disruptions we are looking at, what kind of issues that come up in the supply chain, right from human intervention to cold storage due to global infrastructure, also the ICC costs that we look upon, and the digital intervention that happens in planning and risk management. So, taking all those cues and notes in hand, the first question I would have for all the panelists here is, can you share some successful supply chain models that have driven growth in the pharmaceutical industry? And what are the key features of these models that have contributed to the success? So, if you can start from you, sir.
Hi everyone. So, firstly, thanks for having me here in the panel discussion. And I think we have a very important and very pertinent topic at hand. So, in terms of to answer the question, before I answer the question, actually, from a pharma industry perspective, and especially from an Indian pharma perspective, why is India at the crux of the Indian or global pharma and the pharma hub? So if I give few data points, from an Indian pharma hub perspective, we are kind of supplying almost 25% of the requirement of Europe. So I think that's by all means very, very big. From a US perspective, we are supplying close to around 40% of their requirements. Again, huge by all means, and no other industry in India does it. So I can proudly say that from behalf of all of us as a pharma perspective or pharma fraternity. Thirdly, we are the number one producers of vaccines across the globe. So we almost, I think, cover close to 70 to 75% of the global requirement of the vaccines requirement. And last but not the least, from a formulation perspective, we are close to around 40 billion USD, and I think we are growing in double digits, close to around 19 to 20% year on year. So I think one industry where we all can together as a fraternity proudly say that we are really going at a very fast pace in terms of these numbers, the advancements, and success stories are building up every year. We are breaking our own records through the advancement and support of all the service providers here, and even the technology enablement or digital enablement, if I can say the right word would be. So for us to, from a perspective of, I am here from Reliance Retail Pharma, and we are trying to be as close to the consumer. So from one of the success story, I can say we are trying to build an omni channel where the consumer can order his medicines online through our platform called NetMeds. He can even go to our store, which is a retail brick and mortar store at the nearby Reliance Smart Point. We have our NetMeds store there. Plus, we give him convenience to order at the store, get it at the home, or order online and pick up from the store. So this is omni-channel, where we are trying to be giving multiple options, multiple scenarios enabled by technology, enabled by logistics service providers. How can we put or have customer at the center of what we do and what we intend to do, so that convenience can be there from the end consumer perspective. He just needs to know what he wants to order with the right prescription. That's the requisite for the ordering of the medicines online, offline, and he can get it at the doorstep, or he can pick it while coming from the office. So just one example how digital with the logistics, I would say, or with the enablement of supply chain is helping us service the consumer faster, more better, or I would say more efficiently, keeping his convenience at the center. Yeah.
Thank you, Gaurav. Over to Kalpajit.
Hello. Thank you. Thanks for having me here as a part of this panel. Um, as Gaurav said, it's a very fascinating kind of area, right? Pharmaceutical. I don't come from pharma. I come from supply chain planning space, and I do not find any industry as fascinating as pharma. And I was just telling Vickram when we were talking outside is that look at the kind of complexity you guys manage, right? I mean, and sometimes I wonder whether these are all manageable complexities till they prove us wrong every day, right? The market is in a completely different place. Their sourcing locations are in a completely different area. There are a lot of complexities in terms of their production. There are certifications. There are obviously approvals required. It's like a massively complex thing, right? How do they do that? How do they manage it in a day in and day out, right? And it's a superhuman work. To manage such complexity, I mean, traditional approach of managing supply chain planning is that you go for an accuracy, focus on accuracy. You go for an accurate forecast, you go for an accurate fill rate, you go for accurate material planning. But when you have this kind of volatility and complexity, your accuracy goes for a toss, right? And then what you do is that you figure out how to manage it with a right response, right? Right response to a disruption, a right response to a problem that you face on a day in and day out in your supply chain planning. So your technique of doing supply chain planning also will have to be a little different. A traditional approach of doing a supply chain planning is a cascaded way of planning, where we do a forecast, you do a material plan, the capacity plan, eventually you do a distribution plan, right? That sequential way of planning. That is the traditional way of doing our planning. And that comes from a genesis of supply chain planning itself, which was originally basically an extension of a logistics arm, and then eventually it became the overpowering kind of a department in the organization who almost runs the organization today. So what you need is that you need a technique of planning, which we call it a concurrent planning. So when you say that when your business doesn't happen sequentially, why you do your planning sequentially? Your business happen concurrently. You don't wait for a focus to be over to your doing your material plan. You cannot afford to do that, right? So concurrency is one technique of planning. And when you were asking about the model that has been working right now, and predominantly in pharma, I think that this concurrent way of planning, when you plan everything at one time, you do not wait for a particular process to be over to do a planning for the next process. This is something that is going to define this industry's way of working in coming days. And there are a lot of organizations who have already adopted this. I'm sure that this will get a good amount of traction there. So that is one model that I can talk about, which is evolving, and a lot of pharma organizations are adopting it. The whole fundamental of concurrent planning is that you break those silos which were existing from the demand forecasting to your capacity to your material and distribution. You break those silos, you work as on a single data model, on a single view, where you have transparency across your organization, and you can respond much in an efficient manner than what you have been doing it before. So that is the model that I would like to talk about here.
Thank you so much.
It's okay. So yeah, hi, good afternoon, everyone. Yeah, glad to be here with some, good thought-provoking, discussion before lunch. So food for thought for all of us. And before I answer your question, Sagar, with respect to what models work, I would first want to talk about the topic of our panel. Optimizing supply chain. In my mind, optimizing is important, but we also need to make supply chains resilient, especially in today's VUCA world. I know we've all gone through in the last 3-4 years through a lot of things in our lives, in our businesses, in our supply chains, in all functions. So resilience to me becomes as important. I mean, it has to be built to not just built to last, but built to adapt. So Having said that, I agree with what Kalpajit was just talking about, being end to end with respect to having supply chain models which work, So traditionally what has happened, let's step back and think. What has worked for pharma industry probably will not work for others, because we are unique, as you said in your opening remark. Also, we are probably one of the most heavily regulated industries. So the kind of flexibility that FMCG or a electronic industry will have, a supply chain industry does not have it. For good, bad, ugly reasons, we've evolved our supply chains around that. So if I have to work with a vendor, I know switching to an alternate vendor, if I have need, there is demand, excursions, etc. How do I work with an alternate vendor? It can't be done overnight. Qualifying an alternate vendor, even for simple primary packing materials, can be 6-8 months with a lot of regulatory pathway in terms of cost and effort, charging batches on stability, etc. So the models that we have traditionally worked on is a mix of, in my opinion, a mix of sales and operation planning, SNOP, and SNOE, a mixture of transacting, doing short term changes in terms of our planning, and looking at a mid to long term from SNOP, planning perspective with respect to capacities, with respect to vendor evaluations, etc. But then in today's world, I think we need to break these silos across all departments, look at the end-to-end view, what Kalpajit was talking about, kind of integrated business planning model in which, we look at when this point of sale, my consumption of, critical drugs happen, how that demand can, demand lever can give signals upward to my upstream supply chain nodes with respect to operations, with respect to my vendors, and to my vendors, because just having visibility with my vendors is not enough in today's day and age. We know in the kind of volatile world we are living in today, one effect at one end of the globe, a geopolitical situation in one part of the world, can have a rippling effect to your vendors who is based thousands of kilometers away. So you need to have end-to-end view and complete view of your supply chain, and that is where a lot of visibility, a lot of collaboration comes into play. Thank you.
Awesome. I think all three of you have given us brilliant points, right from customer centric to being concurrence, and now to being vendor centric. Three amazing models, three amazing topics. I would now have a question for Gaurav. So, how can pharmaceutical companies implement more customer centric supply chain models to enhance patent outcomes, ensuring accessibility, affordability of critical medications across various markets? And I think this question is apt for you, where you started with customer centricity and the three different models that you talked about.
Sure. So I think when you talk about customer centricity, you develop your entire planning first of all around that, and it differs from market to market. How can you first of all be very agile? And I think, like Vickram mentioned, resilience. I would just add two more pillars to it. Resilience is very, very essential as one of the key pillars. Second is agility, and third is visibility. So if I talk about ARV, so agility, resilience or reliability, and visibility. When you combine these three, the customer, why, so just taking a step back, why does customers love Amazon so much? When we keep talking about the Amazons, right? And that's the first name when you talk about customer centricity comes to anyone's mind, and no disrespect to any competitor or any other player. So it's because they understand consumer wants agility. They want the quickest delivery possible. They give those options. They give you that visibility. When is it coming, right? So, and that's all enabled by no other team, I can proudly say, but by the supply chain folks, right? The speed of delivery, the visibility at different nodes. It's multi-echelon model that we all are working today on. So where exactly is my shipment? Same ways from a customer standpoint, and not just end consumer. While we are dealing now with the end consumer, the tertiary data, we can say, from a pharma perspective, which is the last consumer, say Mr. ABC, Mr. Gupta, staying in the X pin code. We know that data, right? Because we are directly delivering to the end consumer. So that helps a lot in terms of understanding the end consumer, the end pin code consumption data, and hence we are building our models even more effective by giving those data of consumption. Whereas when I, from my previous organization or previous experience perspective, when I was with Cipla, we had primary and somewhat visibility of secondary. So we were always having those models or guesstimates to work upon. What will be my we don't know what will my end consumer will be ordering, but we know what is my wholesaler, my distributor, my stockist consuming, and what stocks they are having in the pipeline, and we build a lot of guesstimates on that. Here we know exactly what this end consumer takes in terms of cardiometabolism or in terms of urology problems, etc. And I have those more efficient data with respect to pin codes, and hence we are able to build up more accurate consumption patterns and what we need to keep. Hence, from a customer centricity standpoint, the model that works is we need to have a larger assortment. We need to work on thinner inventory, because in the retail you cannot have huge inventories that the margins doesn't allow that much. So we need to have just in time kind of replenishments and quicker and more churns of inventory turns, and hence but the art or the skill is in terms of how do you have what that pin code needs in terms of your availability, so as to have a super quick delivery. So your technology, your digital enablement comes at again as a very, very key enabler. And I can say in India, the good part is we are both the pharma hub of the world. We are also blessed being the IT hub of the world. So of the likes of, when I see on the board here, we have a lot of tech or digital enabler partners you see on the board, right? So I'm supporting your sponsorship. So without on a serious note, I think we are at that digital enablement intersection where I think pharma and digital or IT is kind of working together, and I think a lot of startups that I see are coming in these areas as well. How you predict your consumption, how you predict your demand. In fact, coming from pharma manufacturing, we used to do predictive maintenance. So we never had or the breakdowns or the instances of those issues of machine breakdowns, etc., which were like impacting us badly, dropped significantly when we went ahead with predictive maintenance, right? So now we have, from a consumer standpoint, we do a lot of predictive forecasting, and that feeds into the entire SNOP model. So when you have more accurate data, when you have more precise consumption data, which so it's not about now state or city, it's about pin codes, where at that level of data where we are working, because we want to deliver in hours. So we cannot look at the earlier model where we used to deliver in days time. So we want to deliver and the customer and the quick enablement of technology with the supply chain and logistics, thankfully partnering all together, we are able to do that, right? We are able to do delivery in hours now. So I think predictive will be another key from a customer centricity standpoint. And to add to that, how the SNOP or SNOE, as Vickram mentioned, is kind of driven more efficiently. We all have the data. Now, how we execute that on the ground in terms of getting those supplies, getting partnering with your vendors for agility, because you are working on a thin inventory, you are working in just-in-time models. So how you execute that is the real, I would say, skill of the supply chain enablers, and together the where planning comes and meets the execution, hits the ground on the road. So I think those would be the further key in my view, where I think a lot of work has been done, but yes, still there is a lot to be done on those things.
Thank you so much, Gaurav. Anything that you would like to add, Vikram or Kalpajit? If not, then I would have some specific questions for you as well. Okay, lovely. So this goes out for Kalpajit, where you talked about technology, where you talked about being concurrent in the planning. How can pharma companies embrace digital twin technology to create more agile, more responsive, and efficient supply chain, effectively minimizing waste and ensuring the timely deliveries of life-saving medications?
It is very interesting question, right? Um, and before I address this digital twin part of it, and then we all know the benefit of digital twin, right? You don't, you have your supply chain replicated digitally in your environment, and obviously any kind of activity that you are doing offline will be able to see how it is going to impact online, right? So that's very simple concept of it. But understand what is the implication of digital twin. The implication of digital twin lies in the ability to run scenarios, right? So that is the phenomenal amount of advantage that you get out of a digital twin, implementation of a digital twin. Now, running scenario is fairly, again, ties back to the concurrency that we talk about, right? If you have a single data model without any barriers, without any silos, everybody is having a same view, then it is very easy for any planner to go ahead and run a scenario, a what if analysis. And it takes a very, few minutes, if not seconds sometimes. But if you have a sequential process, obviously it takes a lot of time. Now, I have encountered numerous amount of or kind of instances when the organization gets stuck the moment there is a disruption coming in. And disruption can be a very small disruption, or it can be even the very big ones. Very important part is that whenever there is a disruption coming in, for example, in the area of manufacturing, in the area of material, or in demand, an increase in demand or a reduction in demand or a change in demand in multiple locations, the planner should be able to quickly understand the impact of it, quickly understand what will be the kind of possible scenarios that they can generate, and then collaborate with someone like Vickram or a Gaurav to understand what will be the best kind of an option for them to go ahead with. That is something lacking today, right? And this is not to do with the ability of the organization or technology intervention. It's about the technique. It ties back to the technique of planning that we have been following. And in a traditional technique, it has to be always run in a batch mode, because you'll have to rerun the plan and eventually come out with a scenario. Again, change that particular variable, rerun the plan, again come out with another scenario, which takes a humongous amount of time. With a planning technique of concurrency, it just goes away. So talking about digital twin, I think we talk a lot about it. The most important part of a digital twin is obviously ability to run scenarios, ability to break those silos, and eventually coming out with something which helps both Gaurav and Vickram to take quick decisions rather than waiting for going through the entire process of running those functions, right? So that's will be a short and crisp answer, considering that we are very close to lunch, right?
Thank you so much. And yeah, it aptly said that it will definitely help Vikram and Gaurav to plan better and be concurrent in the time. Having said that, we are very close to lunch. I feel the room is a lot of serious now. So why don't we have some vibrancy which increases our appetite to have more lunch. Why don't we clap hands and increase our blood circulations? Can I have a big round of applause as a middle, just to... And we all being from pharma, we know it increases our blood circulation. So we eat and we have a good appetizer coming up. So for Vickram, talking about vendors, talking about logistics provider, there's something that I want to have your views on. How can pharma companies effectively collaborate with logistics providers for innovative solutions and enhance supply chains performance and scalability?
Very, very good question. Thanks, Sagar, and very close to where I operate from. Because in today's world, and when I was starting in my opening question also, when I mentioned collaboration is key now. I mean, we need to start looking at our vendors, logistic service providers, more as business partners. I mean, it's gone beyond the feel good factor that I need to consciously collaborate or cooperate with them. It's gone beyond to a very conscious collaboration effort that we need to make and make them business partners in our value chain. Because you can have a very simple example of your vendor who's probably somewhere sitting in Germany, and if you're not collaborating with them properly, we all know due to a geopolitical situation in one part of Europe, there was not enough energy being flown into or transmitted into Europe, and they were running not all shifts in their plants, and that led to a shortage of material. So how you can work with your vendors, and vis-a-vis how the vendors can work with you, what Kalpajit was also talking about, in terms of having end-to-end demand signaling and various scenario plannings with respect to, if I look at, say, a tender or a scenario where I can look at, say, 10 batches which are critical to be supplied, and if there's a scenario B where that 10 batch can turn into 50 batches, how do I look at those exceptional cases and look at both my material and my capacity? Capacity is something that I look at internally, I mean, I have my stakeholders, I have better control, but what about my external partners? Same goes for logistic service providers. They play a very, very important role, I mean, because that's the last leg of the value chain for us. From the factory, when I lose control of, how my goods are stored, is the drug supply chain security happening during the travel of the drug from the factory to the warehouse and from the warehouse to the retailer, how I'm going to make sure that the drug security, how I can do geofencing of my transit, how I can look at the temperature control, all these aspects, if we talk about, we need to work with our service providers. We need to work with our, vendors and logistic service providers and collaborate deeply with them. Even if you don't want to do all this, let's park all that I said aside. Look at the cost factor. That becomes key. We all know that if we can collaborate effectively with our logistic service providers, we all know what happened during COVID. I mean, a container to US from $2,000-$3,000 went up to $18,000-$20,000. I mean, it got driven by a lot of factors with respect to availability of containers, a lot of blank sailing, etc., etc. But what I'm trying to emphasize to the audience and to the panel members over here, that the better we work with our service providers, make them our business partners, and have a collaborative effort with respect to how we can ensure that there is no disruption of critical life-saving drugs. Because again, that's the unique position that pharma holds. We are not like a FMCG company or an electronics company. You can live without the next iPhone 16 launch. I mean, it can get delayed by 6 months, but patients can't live without critical life-saving drugs for 6 months. They need their drugs on time. And that is where, the industry and the service providers need to work together so that the supply chain disruptions are minimized as much as possible, because we cannot eliminate them. Let's acknowledge the, devil in the room, that's the world we are living in now. Our supply chains are fragile. They are global. You said, and Kalpajit also mentioned, the complexity that we manage in terms of, sourcing from all over the world and supplying to the world. What Gaurav also mentioned, we are the pharma hub or the pharma pharmacy of the world, India. So, I mean, I can't dwell more, or I can't emphasize more on this aspect, that how we need to work closely with our value chain partners, so that disruptions are minimized, and access to critical life-saving drugs are available to all the 7+ billion people around the globe. Thank you.
Well said, Vikram. Collaboration and co-creation. Basically, that what is the key to having undisrupted supply chain. Talking about life-saving drugs, we all know the semiconductors that were delayed did not cause so much disruption. But imagine a life-saving drug getting delayed will cause a lot more disruption. So now a question to all of you with the elephant in the room. In what ways can artificial intelligence and machine learning be harnessed to predict, mitigate the supply chain risks, ensuring uninterrupted supply, and fostering pharmaceutical growth?
So go first.
So maybe just my understanding or my take on this, I think technology, digital, including when I say digital, it's right from artificial intelligence to machine learning to blockchain to analytics, predictive analytics. We have, I think, been talking and previously also hearing from the panels. So I think they have to kind of collaborate with the solution providers, with the to help solve the problems. And I think not just these technologies or solution, the key also lies in the efficient training of those, right? Because some of these solutions are already there and been there, but we see the person on the ground, he is not efficiently trained. And like in the previous example of, I'm just slightly digressing for a second, previous example of logistics and transportation that you mentioned, a lot of cold chain items, when we see the excursion where it happened, it didn't happen because of the solution, it didn't happen because of the temperature monitoring or efficient monitoring on inside the warehouse. It usually happens in the tarmac, on the tarmac. So the training of the employees or the training of the partners, I should say, is equally important, and where I think we all together as an industry have a lot to collaborate and to contribute together, and that's where partnership comes in, right? Because when you are partners, you kind of do, or you play for each other's success. You try to make others win, and that's where training efficiently. We have been talking about ESG a lot, right? So environment, sustainability, and corporate governance. It cannot happen without your partners being aligned, your partners being enrolled for the success of each other's success, right? So that's very, very important. And again, this will come through or will be enabled through these technologies that we are talking about. So I think that will go hand in hand, and I'm very, very confident with the way technology is enabling. I'm very sure there will be partners to kind of train, partners collaborating to train the ground people, workforce on these tools or enablements like AI, blockchains, etc., which we all know are the future, or rather are the present. There's no doubt about it. So I think it's how you collaborate, how you bring the ground people also to stay invested in the success of the larger picture of the environment or even the organization as well. Thank you.
Thank you.
So I have a very interesting story, right? When just talking about collaboration. A few years back, I was in discussion with the CEO of a company, and then he said that I want to have a collaborative environment with all my suppliers, right? Getting my contract manufacturers, getting all my suppliers, bring them in one platform. Our guys have visibility across everything, so why can't we do that? So I just requested him to just include me in the next S&OP meeting. Like, can I have a can I be a part of your S&OP meeting next? So he said, okay, you come down. So I was a part of the S&OP meeting, and it was a mess. It was the sales, supply chain, logistics, manufacturing, all of them were in all different pages, and then it started. That whole chaotic environment, right? And a lot of us are, aware of those chaos that happens in the S&OP meetings. I came out of the meeting and met the CEO and then told him that, if there is no collaboration among your teams, how are you going to collaborate with your partners, right? So that's where the fundamental belief comes, right? AI and ML are great things. My company, works a lot on artificial intelligence and machine learning, and we see a great future in that. But I think we have to get our fundamentals right before getting into that AI ML space, right? While we can parallelly do that, I'm definitely not discouraging anyone to look at that. The fundamentals lies in the fact is that merely having visibility today is not going to be enough. We need to have something called a transparency. The whole difference between visibility and transparency is that with visibility, you know what is happening. With the transparency, you know exactly what is the risk and impact of something which is happening, right? Unless we have that level of maturity in our organization, understand exactly the impact of a particular disruption coming in that organization, and then how it is going to be playing out to the overall planning exercise, just implementing technology is not going to help out, right? So I believe that we have to get a lot of ways, I've seen it in many places, right? In pharma itself, a lot of our risk, we try to cover it with building up a lot of inventory. And end of the day, we realize that even after building inventory, we pay a lot in premium freight, and then a lot of failure to serve penalties going everywhere, right? So those are inefficiencies which we will have to control, and that can be done with having a proper system with clear visibility, everybody working together, not in silos, in a single view or single visibility of truth, a transparent system where we know exactly what is happening, and not only what is happening, but the impact and risk associated with it. And then obviously look at what else we can do with it, right? And then AI/ML definitely helps in that area.
Very cognizant of the time. I don't want to stop anybody from having a sumptuous lunch, but very, very quickly, adding to what he was also saying, the digital cannot exist without the physical, and vis-a-vis, so both have to be, in a sense, supporting each other. Can we do without digital? Absolutely not. But we are also in the business of making, complex medicines. So the physical aspect of, ensuring you collaborate, you get the material in place, you have the processes and quality norms so that you make, standard medicines which are safe for human consumption. So having said that, with Industry 4.0, right in front of us with blockchain, AI, ML, and I think this will be the fastest industrial revolution from 4.0 to 5.0, with AI, ML and going into robotics. We are already seeing a lot happening in pharma space, other manufacturing, verticals as well. So I think technology is here to assist us, and it's going to make life easier. What my panel members were also talking about in terms of getting the right data point so that I can make the decisions faster, quicker for the organization and for the greater benefit of the value chain. That in my mind is key, and that is how technology is going to help in whatever shape and form you can look at it. Whether it can be a simple dashboard, it can be AI tools, it can be chat GPT or whatever you can call it. It's here to assist us. That's it. Thank you.
Thank you so much, Gaurav, Kalpajit, and Vickram. I think that was a very interactive session, and lots of insights, stories, and learnings that we got from all of you. So thank you very much once again, and a big round of applause to all three of you.